evening. I'm Whitney Rayleigh.
Hi, my name is V and I'm a reporter for Bob Matthews.
Thank you for tuning in to our feature news special, Rocky Mountain Spotted Fever, the Tick-borne Spring Fever. Due in part to the official onset of RMSF season and the first reported cases by the CDC this year, we here at the Science Channel want to raise public awareness of this disease.
Joining us in our discussion this evening will be Dr. Gracie Russell, the Medical Director of Durham Regional Hospital at North Carolina, and Dr. Tabitha Henson, the Doctor of Veterinary Medicine of the CDC. But before we bring in our guests, we would like to share some information and statistics reported by the Center for Disease Control.
Rocky Mountain Spotted Fever is a tick-borne disease endemic to North America. RMSF is transmitted by the bite of an infected brown dog tick. As the mosquito is the insect vector for the disease malaria, the brown dog tick is the insect vector for RMSF in the U.S. In South America, RMSF is transmitted by a different species of tick known as A. aureoltum.
RMSF has been reportable disease in the United States since 1920s. The incidence of RMSF, or the number of RMSF cases for every million person, has increased during the last decade, from less than 2 cases per million person in 2000 to over 6 cases per million in 2010. However, during the same period, the proportion of RMSF cases resulting in death and or case fatalities has declined as low as less than 0.5%. North Carolina, Arkansas, Oklahoma, Tennessee, and Missouri attribute to more than 60% of reported RMSF cases.
And approximately 700 cases are reported by the CDC annually, primarily between the months of April and September. Now that we have laid the foundation for our discussion, I would like to introduce Dr. Gracie Russell. Welcome, Dr. Russell. Thank you for joining us this evening.
Thank you for having me. I'm delighted to be here to raise awareness for Rocky Mountain Spotted Fever. Since I am a practitioner in North Carolina, I see a lot of cases of Rocky Mountain Spotted Fever.
Dr. Russell, what is it about the brown dog tick bite that causes RMSF?
Great question, Whitney. RMSF is the name given to the collection of clinical symptoms. The agent or disease causing microorganism of RMSF is Rickettsia rickettsii. R. rickettsii is a bacteria that commonly infects the brown dog tick. The bacteria may be transmitted to other animals or humans by the tick's bite. The clinical symptoms of RMSF include muscle ache, sustained fever, muscle pain, and lesions.
How long after the bite of an infected brown dog tick do these symptoms appear? And what kind of diagnostic tests are performed on patients presenting for these symptoms?
The way we test for our rickettsia is either by a blood sample of the infected person, we can test a rash, or we can actually test the tick if it's still on the person.
What do scientists know about this bacterium, R. rickettsii, Dr. Russell?
R. rickettsii is a gram-negative bacteria, which means it's a lot harder to treat than a gram-positive bacteria, because the cell wall on gram-negative bacteria are very thin. And the way antibiotics work is they attack the cell wall of bacteria.
The CDC report that the case fatality is 15 to 30% if the infection is left untreated and 3 to 5% if treated, which led me to my next question: how is RMSF treated?
By an antibiotic called Dosulin. Dosulin is used on anybody that's not pregnant, because Dosulin is not very effective with pregnant women. If the symptoms go untreated, if the symptoms of RMSFB go untreated, it can cause kidney failure, septic shock, and may even lead to death.
Are survivors of RMSF at risk for other health complications?
There are many. These long-term side effects may include partial paralysis of the lower extremities, gangrene, amputations, hearing loss, loss of bowel or urine control, and movement or language disorders.
Dr. Russell, thank you so much for your clear and concise explanations. We would now like to introduce Dr. Tabitha Henson.
Hi, thanks for having me.
Dr. Henson, could you explain to us what exactly you do at the CDC?
Of course, Whitney. I work in the Rickettsial Zoonosis branch. Our team consists of veterinarians, public health officials, medical officers, and scientists. I myself am a veterinarian specializing in microbiology and infectious disease. Our team works to contain infestations of infected brown dog ticks and conduct research on this zoonotic disease.
Would you please explain to our audience what you mean by the term zoonotic?
Rocky Mountain spotted fever is a zoonotic disease, meaning it's not species specific. It can occur in rodents, birds, dogs, and humans. The brown dog tick does bite humans, however, its primary food source consists of blood meals from dogs.
I never did like the expression as full as a tick. How does your team control these infestations?
Brown dog tick infestations cannot persist without the supply of untreated dogs on which to feed. So, it seems plausible that treating virtually every dog in a given vicinity would eliminate this problem. However, that's not entirely true. Once these ticks have infested an area, they can persist in the environment without feeding for long periods of time. So houses and yards need to be treated. Prescription tick collars can be purchased at most animal hospitals and usually last up to 3 months. Check your pet thoroughly for ticks after spending time outside, especially in wooded areas. Like most parasitic infestations we see in veterinary medicine, it appears that the most promising course of action for treating these infestations is compliance of lifelong preventive protection for animals in conjunction with professional treatment of the environment.
Thank you so much for having me on and for raising public awareness about Rocky Mountain spotted fever.
Thank you both so much for joining the show with us today. You have given some incredible insight on the subject, and thank all of you who are watching us. Just stay tuned to learn about some helpful prevention tips. Some helpful prevention tips for keeping the Rocky Mountain spotted fever at bay are wearing long shirts and pants when out in the wilderness, not walking through bushes and brush, but staying on the trails, using insect repellent, keep your lawns tick-free by keeping large amounts of brush and leaves in the sunlight, and checking yourself and your pets. Also, don't forget that if you do come across a tick on either yourself or your pets, remove them with tweezers. Thank you guys so much for joining us. Have a great one.